Hi, it's Dr. Shirley. Today I'm going to talk about how to prevent recurrent vaginal yeast infections. So we're all going to get them at some point, and when you get a vaginal yeast infection, you're going to have symptoms of thick white discharge that causes itchiness. Now, it's normal to have normal vaginal discharge, but that is not itchy. If you're not sure if it's white, then if you lightly scratch the vulva skin on the outside, you'll notice that it collects as a white substance. Usually when you get recurrent vaginal yeast infections, you are most likely eating too many carbs in your diet. So the first thing you want to do is cut out the carbs, including bread, rice, and noodles, and the candies. I know it's really hard, but it's super important. Next, you want to take 2 tablespoons of apple cider vinegar in a cup of water, and you do that twice a day. The reason why you want to do this is because carbs increase the pH in your gut, and apple cider vinegar is an acid and it brings it back down where yeast don't like to grow. So you do this when you first feel an itch coming on. Hopefully in a couple of days that'll go away. Now, if it gets worse and you're actually scratching yourself, and ladies, you know you can't scratch that place in public, that's just not okay. What you can do is use boric acid suppositories. You can get these on Amazon or you can make it yourself. If you get it, you want to get the fine powder kind, not the granular kind, because that can scratch. You can get these pre-made. And they're really affordable. Boric acid vaginal suppositories are actually a first line treatment in Canada, although it's not here right now. It's a natural way, a gentle way to take care of an infection without building your own personal resistant yeast in your own body. The way you want to do it is you want to insert a 500 milligram capsule of boric acid vaginally twice a day, once at night and once in the morning. Ladies, remember that what goes in must come out. So when you do this, you also want to use a pad to catch the flow when it leaves your body. This may have a slight burning sensation, but that is mild, it's bearable, and it's definitely better than any sort of itch. A mild burn is better than an itch. Usually you do this for a couple of days and it goes away. If it is itchy on the outside, you can also powder yourself with fine boric acid on the outside to help with the itch. If it gets so bad that you can't stand it, then you can go to CVS and get something like Monistat, which is over the counter. They have different kinds, and people ask me what I prefer. They have the capsules and they also have the cream. I prefer the cream because there's just more surface area and you feel better faster. Next question is, do I pick the 1 day, the 3 day, the 5 day, the 7 day? What is the difference? So if you pick convenience, like a 1 day treatment, you are going to get more resistance, meaning in the future it might not work as well, or it just might not work at all. So I usually recommend a 5 day, 7 day treatment if you can handle it. And it's important that when you do this, you also use a pad to catch the flow. Also, when you get your period, you want to keep on using it anyways. If you stop treatment early, you'll just get resistance. What you'll find is if you do the 7 day a couple times, it won't work anymore. Then you move up to the 5 day treatment. When that stops working, you work your way up to the 3 day treatment, and so on. I think that if you can't use suppositories, then difluconazole would be a treatment for you, but that is the easiest way to build resistance. And when that doesn't work, then you have to rely on these other treatments. And these topical treatments are not systemic, so you don't build overall fungal resistance. And this is really the best natural way to treat your infection.